The Member Recognition Awards were established by the Medical Society in 2015 to recognize high-achieving physicians who go above and beyond in their service to profession and community. The Patient and Community Advocate Award recognizes a KCMS member who has made significant contributions to helping patients with access to care or improved quality of care. Sharing the 2019 Patient and Community Advocate Award are Dr. Peter DiPasco and Dr. Leland Graves. They generously donated their services to treat a woman with thyroid cancer who had been referred by the KCMS Foundation's WIJO Care program. WIJO Care helps uninsured people gain access to donated specialty care. Dr. DiPasco performed the surgery in June, and Dr. Graves is providing ongoing care, which soon will include radioactive iodine treatment. They also secured donations of hospital facilities and services from the KU Medical Center.
When Dr. McGreevy called, I was very excited to help. She's a wonderful person who has organized a lot of care for patients who can't get the care they need around town. And it was apparent that there probably was thyroid cancer still there, that the surgeon who performed the operation hadn't completely removed it all. Radioactive iodine has to be put off, and you really need to have that surgery be complete and all the tumor that's there removed. So at that point, I needed another surgeon. So I contacted Dr. McGreevy, and we began looking for a surgeon within KU who would be willing to take that on. The University of Kansas Health System stepped up and provided the lab I needed to care for the patient, provided ultrasound and radiology that was needed, provided the nursing and the rooms and all the things that are needed to take care of a patient. So we could not have cared for her without the health system. I agreed to take on the patient because it's the right thing to do. People need to be taken care of, and if they're in a situation where they can't get access to the care they need, this is what we do. We take care of people who need help, and that I would urge all my colleagues to participate in programs like this.
Whenever I receive these requests, I immediately say yes. The day of the surgery, it was a lengthy surgery. There was quite a bit of scar tissue that I worked with. The actual surgery was booked for about 6 hours, but I do believe it stretched to the 7th or 8th hour. And that's simply because there was so much work to be done in order to try and remove all of the disease that was still present in this patient's locally advanced case. As much as it may be easy to think in an isolation tank as a surgeon, well, I'll just volunteer my time, it's not that simple. It really requires the resources of the entire institution to be levied and offered in a very similar mindset. And KU did that without any hesitation. To me, the opportunity to care for a cancer patient is really the passion of my career. With that comes with responsibility to use this privilege that I've worked so hard to gain. Unending compassion for cancer patients, and here I recognized a patient that certainly had an advanced case and needed additional care.